Good morning, good afternoon. Welcome to this first webinar in a cycle of webinars on climate change, migration, and health in Latin America and the Caribbean. I am Baltica Cavieses. I am an epidemiologist from the University of Development in Santiago de Chile, and I'll be hosting this first webinar. This webinar cycle will take place every 2 months, starting today on the 5th of March. We will be addressing a topic on this emerging topic of climate change, migration, and health with a focus on Latin America and the Caribbean. This event will be held mostly in Spanish, and we have simultaneous interpretation into English. This webinar cycle is brought to you by the Science Institute of Innovation in Medicine, University of Development in Chile, together with the Global Consortium of Climate Health Education from Columbia University in the United States, and also LAC Migration Latin America, and the Inter-American Institute for Global Change Research, and also the Chilean Network of Research on Health and Migration, REGISAT. Before we start, I'd like to give you some general information about how this webinar will work. First of all, thank you on behalf of all these organizations and all this team. Thank you for registering, and thank you for being here with us today, participating in this webinar. You can say hi in the chat or in the frequently asked questions. Please tell us your name, your affiliation, and your country so that we can meet and start this conversation in the chat or in the Q&A section in this webinar and in the future. Please remember that we have simultaneous interpretation into English. And to do that, please go to the bottom of the screen where you will see a globe icon. You click on that and you can choose the language you would like to listen to, English or Spanish, in this seminar and the future events as well. We have expert panelists today with us, and we hope you really enjoy the session. If you have questions or comments, please include them in the Q&A section. We will be selecting some questions and we will be answering them in the Q&A session after the panelists' presentations at the end. We'll try to answer as many questions and comments as possible, but because of time constraints, we won't be able to address every question, so please bear with us. Every question and comment that is not addressed will be addressed in the future, and we'll try to address them in future seminars. Everything you tell us or ask is important to us. I will be saying this again in English, just for those who are speaking in English. And after this, everything will be in Spanish. So, how did these seminars come about? Well, we aim to analyze and reflect on the dynamic, complex, and multi-level relationship between climate change, intergenerational migration, and uh, the health of Latin America, people from Latin America and the Caribbean. We will be talking about the strong connection between the co-organizers of this event, and we will also invite you to reflect and debate on evidence and its exchange by uh, applying evidence-based knowledge based on our local knowledge of the region with real-life experiences in the uh, diverse, heterogeneous, and wonderful communities and countries that we have in Latin America and the Caribbean. This first webinar is entitled Climate Forces that Affect Health and the Well-Being of Children and Adolescents on the Move in Latin America and the Caribbean. This first webinar will describe updated evidence on climate change as a relevant force, but understudied force on the health and well-being of children and adolescents on the move in our region. We estimate that the number of children and migrating children and adolescents has increased in the last decade in Latin America and the Caribbean, in particular regarding the number of children and adolescents who migrate alone or are or somehow vulnerable. The vulnerability risk and social vulnerabilities and health vulnerabilities these children and adolescents must face have been are now globally and regionally acknowledged. But we need to focus on climate change in this regard. And this connection has not been well debated. We aim to connect the local evidence in Latin America and the Caribbean in order to contribute to local and global debates in our region and our countries and communities regarding the importance of protecting children, especially children on the move in the context of climate change. First of all, I would like to give the floor to Dr. Alexandra Baci. She's a social anthropologist, has a PhD in social anthropology. She has a master's degree in gender studies. She has a PhD in social and cultural anthropology. She's the executive director of the Global Intercultural Center of the University of Development. She studies the behavior of different human groups and their connection with health. She focuses on the study of interculturality, gender, and the identities in different social cultural contexts, including in health contexts. In the last few years, she has focused on adolescent health and young people's health, especially sexual and reproductive health, including people on the move. Welcome, Alexandra, to this webinar. You have the floor so that you can start speaking. Thank you so much, Baltica. Good morning, everyone who is here today. As the Executive Director of the Global Intercultural Global Center, it's an honor for me to welcome you from our research center. TESI is an interdisciplinary inter-school center hosted in the School of Medicine and School of Psychology of Universidad del Desarrollo in the city of Santiago de Chile. We aim to develop knowledge in priority areas that include different health disciplines, medicine, nursing, etc., social sciences, and also other areas such as psychology and anthropology regarding some priority topics that focus on health focused on Chile and in Latin America. We aim to provide excellent knowledge about the complexity of health globally in current modern societies, and to create practical solutions to face the main challenges that Chile and Latin America are facing. And we need to include theoretical and practical knowledge created in other parts of the world, and we need to provide our global South perspective. We study migrant the health of migrant people, refugees, also sexual and reproductive health, organized patients, and the well-being of children and adolescents. We address all this from a global health perspective, also from a social variety perspective, inequalities in health and social vulnerabilities in health. Also different health, gender and sex health systems, and the well-being of children and adolescents. To face these challenges, to address these topics, our health center develops methodological strategies that include interdiscipline, transnational research, implementation, science, and mixed research. We do academic work, and the center has also supported the creation of networks and associations in the area of intercultural health, including OSIFAN, which is a migration Chilean network. And it works with a collaboration network of researchers and professionals that focus on international health and health issues in order to do some sustained work over time with the aim to exchange knowledge, cooperate scientifically, and also the aim is to transfer research and evidence-based experiences to take specific action, including political agency interventions in health, monitoring inclusions, social and cultural equality, etc. Rechisan has over 80 members around Chile from different regions and different professionals. So we'd like to invite everyone invited in visiting our website, saludmigrantes.cl, in case you want to have a look at this huge challenge. Also, our CESI Center implements the interdisciplinary program that welcomes migrants in Chile, PM. It is an new alternative to help migrants regarding the availability of health services to help these people integrate in our Chilean society within a framework of rights. Finally, since January 2024, our Global Intercultural Health Center has become a reference center for the WHO. It is the only one of its kind in Latin America. So we are leaders and responsible for developing this type of global health area in the region and globally. So we would like to start this seminar with Columbia University. Other prestigious institutions have joined us, such as the IAI, Lancet Migration, and Lancet Migration Latin America, Migración y Salud, and Rechisam as well. Thank you to all our colleagues from each of these institutions. And once again, I would like to give the floor to a director of our CESTI Center Baltica. Thank you so much. Thank you, Alexandra, for these welcoming words, because they highlight the importance of this cycle of webinars for this region and Chile. Now I would like to invite Dr. Ana Stewart Ibarra. She is the Executive Director of the Inter-American Institute for Global Change Research, the IAI. In this role, Ana supports the member states of the IAI in their efforts to exchange relevant scientific data regarding global change to have a sustainable Latin America. She's an expert in climate and health in Latin America and the Caribbean. Her studies have focused on understanding the climate, environmental, and social factors related to vector-borne diseases and other areas of human health in Latin America and the Caribbean. Anna, it's an honor to have you here today. Thank you for supporting this webinar cycle. You have the floor. Thank you so much, Baltica. Welcome everyone who is here participating, not just in Latin America. I see colleagues from around the world, and it's really a pleasure to be here with you today. From the Inter-American Institute for Global Change Research, I would like to welcome you again. Our mission is to promote the production and use of scientific knowledge on global change processes in order to inform decision-making in our 19 member countries from the Americas. the priorities of our countries right now are climate change and loss of biodiversity and ecosystem services and their intersection with health, poverty, and inequality. The migration crisis that we see in Latin America then emerges in this context, and it requires a TD approach with a focus on equity and social justice. Right now, we are funding several TD research teams on migration and global change in Latin America as a part of a global development forum call. In this sense, it's a pleasure to be part of this group of organizers. This is a very important course. It's a fifth one we've organized together with the GCCHE. And we have reached thousands of people with these courses that have been really impactful for capacity building and networking in the region and globally. The last course we held in November last year was about El Niño and health. This information is available for free on our website. Without further ado, I would like to welcome you. Have a great webinar and hope you can meet each other and build the networks we need to address the challenges posed by migration and its impacts on society. Thank you so much, Baltica. Thank you, dear Anna. Now I would like to give the floor to Cecilia Sorensen. She's a director of the GCCHE from Columbia University. She's an associate professor of emergency medicine at the Columbia Irving Center, and she's an associate professor of environmental health sciences at the Mailman Public School of Medicine. As a researcher and physician, she works on the connection between climate change and human health. She focuses on translating her research into policies and clinical action in order for vulnerable communities to develop their resilience. Dear Cecilia, it's great to have you here today. Thank you so much for accepting this invitation to support this cycle. It's an honor to have the GCCHE here with us today. Nothing would be possible without you. And this is a great space to learn together and to grow together. You have the floor, Cecilia.
Thank you so much, Baltica. It's really wonderful to be here, and I'm honored to welcome everyone here from around the Americas and around the world to this unique webinar series. And I want to give a huge thanks to all the partners who came together to make this webinar series possible. We know that because of climate change, we are facing unprecedented emerging health issues, such as the impacts of migration on health. And it really takes all of us to come together to share knowledge in order to build resilience among vulnerable patients and among vulnerable communities. And so thank you all for being here today, for dedicating your very valuable time to learning about this topic. I'm sure you will have many contributions to offer on your end as well, and we look forward to a lively discussion after we hear from our panelists today. The Global Consortium on Climate and Health Education was formed in 2017 to ensure that health professionals globally have the knowledge and skills to prepare for and prevent climate-related impacts on the patients and on the communities in which they serve. Membership to the Global Consortium is entirely free, and we invite you to join as an individual or as an academic institution or as an NGO organization. We will drop a link in the chat right now, and this will allow you to be able to keep up to speed with all the activities which we are offering through the consortium. So without further ado, I will turn the mic back over to Baltica, and wonderful to see everybody and look forward to this learning journey with you. Thank you.
Thank you so much, dear Cecilia. And now we are going to go into our presentations. We have a researcher, Alejandra Carreño, who has a master's in ethnomedicine and a doctorate from the Siena University. She has been studying suffering in migrant and indigenous populations, health and disease processes in different indigenous health systems in Latin America. She has also researched gender, body categories, and life cycles. and their respective influence on the experience and care of health. In the last few years, she has especially been studying prevention strategies in children and considering motherhood and fatherhood in context of migration. Thank you for being with us. Alejandra, you have a few minutes. I will let you know when you have 2 minutes of time so that you can close, begin to round up your presentation. Without further ado, you have the floor. Thank you so much, Baltica. Thank you, everyone who is in the room today. It's really exciting and overwhelming to see how much interest this has arisen so that we can all address collectively this phenomena that affects us all globally. Now I'm going to begin with my presentation. And now, so to set our presentation in context, I would like to address migration of children and adolescents in Latin America. In our continent, we seem to have particularly large number of children present. They are 15% of the migrant population worldwide, but in Latin America, it reaches 26%. So in our continent, it's especially, we have a migration that is especially young and consisting of children. So we have some specific traits. We have the northern border in the US. It's flowing, the migration flow goes north. And we also have the Darien forest in the border between with Panama that is taking a relevant role with the migration flow that was increased when some borders closed due to COVID during the pandemic. We also have Venezuela has especially been a source of migrants that have spread throughout the continent. It's also worth mentioning what has happened in Haiti in the last few years, which has had a population that has moved towards the southern corner and also towards the north. And we also have a significant number of migrants from Nicaragua. What do we know about the conditions that these children and adolescents are experiencing migrating? We know that there's a significant number of children in the specifically, particularly dangerous borders, especially, for example, in the Darien forest, we had around 250,000 people in 2022, 40,000 of which were children and adolescents. So we can also see the number of detained children at the US border has also increased. As for the migrants from Venezuela, it's estimated that 42% of the Venezuelan migrants are under 18. We also know that Haitian migrants also comprise, we have a large number of Haitians living abroad, and of the deportations that were done from in the US in 2022, there were 2,300 children and adolescents that were of Haitian parents, but they had been born in Chile. So what do we know about the health of migrant children and adolescents? There is some evidence internationally of the issues that begin accumulating since childhood and that affect the present of these children, but also their future, because during this life cycle, the inequities that they are subjected to, even in utero, will affect their conditions throughout the rest of their lives. And internationally, there's some consensus of discussing this as layers of inequity. We have access barriers to prevention, healthcare, and healthcare services that then translate into an excess use of emergency care. Also, we have issues with infectious diseases that have to do with social determinants of health, such as tuberculosis and Chagas, that are more and more present in young migrant populations because they are subjected to barriers to access to this prevention care. And so we have these determinants that have to do especially with the poverty conditions that these people live in. We also have literature from the US showing the effect of the exposure to pesticides and contaminants leading to cancer in children, which is also connected to social determinants of health. Also, as for dental care, we see that migrant children are lagging behind as well because they have less access to preventive care. And this also has to do with the changes in diet, because when these children go from food insecurity to having access to high calorie and highly processed foods, such as the one that are available in their destination countries. Mental health is also an issue that shows up in literature often. We know that they are going through this at such a critical time in their lives for their development. So they're going through these transitions in borders, experiencing different kinds of violence, stress, also some family relationships that are breaking or changing. Exposure to xenophobia as well, that affect them particularly. Sexual and reproductive health is an issue that is also not often made visible because we forget that that age group includes adolescents, and many of the young people who are unaccompanied are adolescents. So the threats to sexual health also have to do with the criminal networks that act in these borders and have to do with violence and sexual abuse, but also with the barriers to reproductive health care, to contraception that could prevent pregnancies at this vulnerable population. We also have the emergence of respiratory and allergies, respiratory illnesses and allergies, living in camps, in irregular settlements, the children are exposed to more to these factors and don't have access to any preventive care. The migration of children in Latin America and the Caribbean has multiple causes. There are many factors, socio-political factors that cause these migration flows, different crises in different countries, and a combination of all of these factors such as poverty, inequality, organized crime, limited access to rights, etc. But all of these are also intertwined with climate change, which is something that goes well beyond the action of nature and is connected to has to do with the political organizations that rule our world. So climate change, on top of all of these, is also causing conditions that will will act as a force that drives people away. So all of these factors that have to do with climate change, without a doubt, have an effect on creating new migrants and the conditions at which they're going to travel. It's also important to stress that climate change has increased internal displacements. And it's also important to consider internal displacements as part of climate migration, because many times we perhaps separate international migration from internal displacements, showing how borders act as a theoretical force here. And it's kind of obtuse to separate that. We are seeing also an increase in internal displacements due to climate factors. And here we have a classification from the Internal Displacements Monitoring Center. And we see that in 2021, internal displacements caused by climate factors were even more than those caused by violence or conflict. And so I took this photograph that is from a UNICEF report from 2022 that sort of sums up very viscerally the effects of climate change on children. This is a picture of a child who is coming back to his community in Nicaragua after a hurricane has passed. And we can see the effects of climate change on our continent. We know that a lot of research, and perhaps a research done by many of the people listening now, show the vulnerability of our continent to climate change, with an obvious increase in temperatures, a rise in sea levels. The Atlantic Ocean is rising faster than other oceans worldwide, and this increases the pollution of fresh water. We know that hurricanes are becoming more frequent, affecting the islands in the Caribbean the most. And we also know that wildfires and droughts have increased to 100% in South America, leading to a loss in biodiversity, among other issues. And so given this, we can say that the effects of the climate crisis are also affected by a crisis, is also a crisis of the rights of children. And how do we arrive at this? Well, we know that children are more vulnerable physically, and they are have less ability to endure and survive things such as floods, droughts, and fires. We know that they're also physiologically more vulnerable to toxic substances, associated to environmental pollution, such as lead, for example. And we know that they're not just going to experience those effects in the present, but also in the future. We also know that they are at a higher risk of death from diseases that are being made more severe by climate change, such as malaria and dengue, and they're also suffering the consequences of the deterioration of social health determinants, such as food insecurity, drinking water, etc. So what do we know about this? Well, it's important to stress that research of the effects of climate change on the health of children is still full of gaps. But there are some things that we have some evidence on about the effects and its link to climate change and its effect on the health of children. We know the effects of food insecurity and how it increases childhood obesity. We know that when access to healthy foods is lower or reduced, then we look for processed, more high-calorie foods. And this happens especially with migrant populations. Also, where wildfires have happened, we see an increase in children hospitalization, especially having to do with respiratory problems. This isn't just during the time when the fire is taking place, but it also happens months and even years afterwards. We also have an increase in chronic disease caused by environmental or connected to environmental factors, such as having to do with toxic materials and pesticides that are present where we have settlements or populations with children. And migrant children are living in these places, and every time that the families have access to housing, it's only in these kinds of places. We also have a record of the influence of high temperatures on maternal and child health, especially low birth weight and size and height. We also have evidence of the effects that droughts and the presence of hurricanes have especially caused in Latin American countries, and how this has increased the flow of migrants towards the US. And this shows that the highest migration pressure is especially on the younger populations, both in internal displacements, rural or urban displacement, and international migration. Here we have a brief summary of some reviews in the literature that you can read if you would like to. And in closing, I would like to show some results we have of some studies that we did in Chile with migrant children from our who are in our country, and with which we have also made the effort of bringing an inclusive perspective on climate change into our studies.
Until very recently, our studies focused on international migration without considering climate change as a factor that is interconnected with political and economic and rights crisis that we are facing. So we need to establish a connection between the migration experience of families traveling with children and climate change effects in the region, and also in their origin and destination origins. These are the territories we focus on. Both two studies, qualitative and ethnographic factors. The first study is still ongoing, and we have also included the voice of children. Therefore, we focus on children and adolescents. And the second study is a complicated study that has been assigned by the Ministry in Chile, and it will be available very soon. Results of both studies. We have collected information regarding the importance of food insecurity as a factor in migration, and also the eating transition that migrants must face, because in their origin country, the children suffered food insecurity. And in Chile, they have access to a higher calorie, a more industrialized diet. These testimonies show us the opinion of children as caretakers and the opinion of health teams. We can see cases of malnutrition in children that arrive in the country, also pregnant women, and the importance of food insecurity as a clear factor that was included in this on this insecure and dangerous journey. Also, natural disasters affect the migration of children and adolescents towards Chile, especially children and adolescents from Haiti. Sorry, there's no sound. We seem to be having an unexpected connection issue with our colleague. Just bear with me for a few seconds so that she can join our meeting again and resume her presentation. We're doing well with time, so we can take a few minutes so that she can rejoin us and complete her presentation. Thank you. So she is telling us that she has a connectivity issue at home. So let's wait for her. Well, actually, she had very little to go. Okay, so now we would like to give the opportunity to our two following speakers so that they can participate and so that we can give Alejandra some time to rejoin us. So now we'd like to give the floor to Dr. Manuela Orejuela Krim. She is an associate professor of epidemiology and pediatrics at the Medical Center of Columbia University. Her research as an environmental epidemiologist and oncologist focuses on environmental impacts during vulnerability times during childhood and adolescent development. She focuses on migrating Latin American adolescents as unaccompanied minors when they migrate to the United States. With researchers from the Mexican Public Health National Institute, Dr. Ojuela participates in several studies that assess the intersection between the environment, diet, and children's diet in Mexico. And she also co-leads a multi-sectoral team that evaluates food insecurity and eating habits of migrants that go through Mexico. Dear doctor, it's great to have you here with us today. You have 10 minutes to participate. You have the floor. Thank you. Thank you, Baltica, and it's an honor to have been invited. Thank you so much for this invitation. And thank you so much to Dr. Carreño for her comments and anthropologists from the Universidad del Desarrollo. She talked about her presentation. So it's important to consider climate change and climate conditions and how they impact families, because they are forced to migrate. They cannot go back to their homes. And we know we also need to consider long-term consequences of this on the health of children. I would like to make a few remarks regarding the times during childhood where children are the most vulnerable, and we need to include climate factors. This might affect children that travel with adults and those that travel alone. And we should also consider what we call active transit, people on the move, because this involves some aspects which are essential and specific to this stage. Also, migrating children are not always healthy children. And we need to remember this in particular, because one of the reasons why a minority of families migrate is because they're trying to get their children a better health treatment, for instance, because in their origin country, they have limited options. These children are particularly vulnerable. They might have chronic diseases. They might need to take some medication. So these children are less resilient and are even more vulnerable to uh, the difficult conditions where climate can actually affect their journey while they are traveling to their desired destination. It's also important to consider that climate factors may include aspects that children haven't been exposed to before migrating. Dr. Carreño talked about pesticides, for instance, and contamination. Therefore, it's also important to consider this, especially regarding the path they're on when they are on the move. For instance, the exposure to pesticides or other fuels maybe might vary, and this might be a first-time exposure and may cause respiratory problems, also allergies. And these children might need access to health services. Maybe they don't even know which health problems they have because it's something that they haven't had before. Also, this new experience, let's say, while they travel, might lead to eating problems, not just because of food insecurity, because this is a major factor, of course, but also there might be uh, constant changes in the water they drink, in the bacteria that might be harmful or not, but in any case, it's different water. And also new or unknown food to children, especially younger children. And those who are adapting and those who are starting to eat new foods. So the families usually eat certain types of food, but now if they are on the move, they need to eat other things, and they need to adapt to the eating habits of the countries they are migrating through. So food, water insecurity, and this also depends on the climate-related factors on their journey. So this is not necessarily dependent on natural disasters. It's just unknown climate factors. It's also important to remember that unaccompanied children or adolescents throughout adolescence, so between 10 and 19, according to the WHO. But we need to remember that we have adolescents aged between 14, 15 until the age of 19. They are vulnerable because of the policies in the countries they go through. These policies might lead them to more vulnerable situations on account of climate issues, storms, heat, etc. These adolescents would rather not take risks, and they don't want to maybe stay in shelters because they don't want to be reported to the authorities. In particular, because some countries want to reunite families with good intentions, they want to reunite families. But some countries have active policies whereby children are sent to their families again without their consent, or even if they don't want to. So they want to protect minors, yes, but this might have a negative secondary effects, especially in the case of climate change scenarios or more vulnerability to climate extremes. Children might also migrate from areas where there are different vaccination schemes. They might be exposed to diseases they don't know how to protect themselves from. For instance, dengue-like disease, they don't know how to protect themselves. They don't know which actions they must take. So these diseases are aggravated by climate change. And as I said before, especially unaccompanied adolescents are more exposed to higher risks because of the conditions that force them to migrate. We also need to remember that unaccompanied minors might be more vulnerable in situations where policies might seem to favor migrating with minors. There is a danger of kidnapping, insecurity. Maybe people want to go through more remote areas because of this, or more vulnerable areas. Children don't want to stay in shelters because they feel that they might be victims of, for instance, gender-based violence. Finally, we need to remember that educational level and the emotional maturity of these children might affect their decision making, and they might not be able to protect their own health. There might be floods, earthquakes, etc. Maybe they're not used to these natural disasters, so they don't know what they have to do to protect themselves, and they might not be paying attention to mass media who might be issuing warnings. Maybe they don't know what the warnings are. They might seem mature because they are migrating alone. They might seem independent, but they are still children, emotionally speaking. So they need our support as a society and as a public health system. Thank you. Thank you, Manuela, for the depth of your comment, for your scope, and for the number of examples you have shared with us. Thank you so much. Now let us give the floor to some closing remarks by Dr. Carreño because she had some connectivity issues. So, dear Alejandra, you have 2 minutes so that you can complete your presentation. And then we'll go to the final comment and to the Q&A session. Thank you so much, Baltica. I'm so sorry I had an unexpected problem, but I was about to complete my presentation. I was talking about the impact of migration and climate change on the mental health of children and adolescents. Can you please set the presentation mode? Yes, let's see if I don't want to try again because this might cause some connectivity issues. Sorry. Thank you. So this also has to do with what Dr. Manuela has said regarding the psychological and emotional conditions of children and the experiences they go through during migration, and also on the capacity to understand what's happening and to react. Finally, I don't want to have a problem. This is why I'm not showing the slide. We also have evidence regarding the effects of climate change on the living conditions of people and where people settle down, in particular families with children and adolescents. in particular informal settlements, where they're more exposed to pesticides, contaminants, allergens. And also my colleague talked about some factors that children, adolescents, or families do not know how to handle. For instance, cold weather, viruses in other countries, etc. Finally, I would like to talk about the importance of considering climate change as one of the factors that interconnect with the migration of children and adolescents. Also, we need to understand that this is part of the inequalities that these people must face. These are also impacted by climate change. It's an inequality and climate crisis. Health services and communities can actually get ready to be able to face the effects of these phenomena with resilience. Thank you. Thank you, Alejandra, for completing your presentation. I've received very positive feedback on your presentation. Thank you so much. Let us now go on to Michael Lieber. He's a physician. He's a medicine historian and anthropologist who trained in Germany in the University of Bonn, in Spain, Oviedo. He has worked on tropical medicine and primary care and other areas in Germany. He has worked on, he's a researcher and a teacher. In 2003, he started working in the Medicine History Institute at the University of Gießen. He has been a professor on migrations and global health since 2022. In his research, he focuses on the history and the current dynamics that have to do with social medicine and human rights-based health approaches with a focus on Latin America. Since 2020, Dr. India has been a focal point for global Lancet migration and its Latin American hub. Dear Miguel, thank you so much for being here with us today. Well, you have 10 minutes to make a presentation or to comment on this. And also, you might want to talk about Lancet migration in Latin America as well. Thank you so much. Welcome. You have the floor. Thank you so much, Baltica. Thank you, Alejandra, Manuela, for these excellent presentations. I'm truly impressed by the quality of your work and also because you have clearly analyzed the situation, which is quite complex. And we've been talking about this for a long time. We've been talking about the nexus between migration, climate change, and health, which is quite complex to teach. But you have talked about very important action lines. Thank you, Baltica. Lancet Migration is an initiative based on health, migration and health Lancet. They published their report in 2018, and in 2020, we created regional hubs, one in Europe, but the first one was created in Latin America in Lima. It's an honor for me to collaborate with them. We have many colleagues from different countries, and we are open to welcoming other colleagues from different countries. And if you're interested in this, please write to me or write to Baltica, and we'll be very happy to answer. Also, Isa Wojciech in Mexico, Andres Cubillos in Bogota. They are the current coordinators of the hub. And also today I will be talking about something we usually discuss with them. Thank you, Carolina Batista and Carol Rojas, who have helped me understand the context of climate change, migration, and health.
And so now to sum up, from my point of view, some of the points that were perhaps the most relevant from the previous presentations, and I would like to add a few comments as well. But thank you for the analysis. I agree a lot with what Alejandra said, I think Manuela as well, that this is a climate crisis, but it is also a crisis of inequality. And we need to take this into account every time we look at climate change and health. And also perhaps a personal comment to what you have, addition or comment to what you have said. It's unbearable, the situation of what you have presented And I wonder, perhaps for me, the central question is, why are they in this situation? What responsibility do they have, these children? Their future, their ability to have a good, healthy life is so compromised by climate change in these different conditions of migration that are so desperate. So this leads us to the concept of climate justice. It's something that we need to stress. These children and their families are the victims of ways of life and of living conditions in other countries, such as in my country, in Germany, but countries in Europe, in the US that have created all of this carbon and emissions and caused climate change, and now other people are paying. So there's the concept of justice that we need to bear in mind. We see this as well in the context of migration caused by climate change, by droughts, by weather events. And there's a study that I appreciate Carol Rojas from Central America for giving me this, that shows that the migration of rural populations that are leaving their land because it's no longer fertile. So their last resort to survive is to just voluntarily leave. They're being forced because there are no further resources or alternatives to live, to make a living where they are. So they mentioned in the previous presentations this active migration transit, but that means they're on the way. But we look at this in Latin America. In Europe, we have also a fence to prevent migration from the south. But then where do they arrive? Are they at a place? Do they reach a place that receives them, where children can have access to education, to play, to a healthy life? Who of all those people that leave the misery caused by climate change and other factors? We also know violence, and violence for land is also closely connected to climate change. So what are their perspectives, their outlook at the places they arrive to? There's no definitive final destination where they're going to be at peace. We, for example, see migrants from Haiti who were, for example, living in Chile for a while. Now we find them at the Darien region because their conditions were not good enough, and they're trying to travel north, where conditions are also uncertain. So this is also connected to the mitigation actions and for the consequences of climate change. For example, when there are droughts or when there are high temperature events, the ones that are affected the worst are the poorest populations that cannot live in the safest areas in the city. They cannot invest in insurance for their houses. In 2019, the special rapporteur for the UN on extreme poverty and human rights said that there is going to be kind of like a climate apartheid, tremendous inequality between the people who can defend against the conditions of climate change, who can migrate to safer places, and those who cannot and are entirely exposed to the negative consequences. And this is a justice and inequality issue that we need to face. What makes, or one of the reasons that I see that makes all of this so problematic, and that we should face from a human rights perspective would be to point that those who are the most responsible for climate change need to invest, need to be held accountable for the damage they have caused, so that those who are suffering won't suffer those consequences as much. And that is one of the factors behind the situation that makes it even worse, is that both climate change and migration politically are not being addressed systematically. There's a huge gap between what we know, the evidence we have of climate change, and the evidence that we have on how to prevent and reduce emissions of climate active gases, and the measures and the political action in these countries that are causing these emissions. So we have a political action deficit in this area. And this also happens on migration and health. We see, for example, in the US, but throughout the Americas and in Europe, migration policies are not considering the migrant people, but it's more something trying to control immigration, not taking into account the rights of these people, making their situation worse. It's made worse by the lack of policy, by climate change and lack of mitigation actions. And so this is a vicious cycle, a negative dynamic of vulnerabilities that are overlapping. And so people are suffering so much, which is ethically unacceptable. And we need immediate action. So thank you, Angela, Manuela, for showing very clearly paths for action. Alejandra said we have enough evidence, and yes, of course, we need more research. We can always research more. But in order to take action, we already know enough, both on climate change and health. We already know what we can do better as governments, as civil society. And in closing, something else is that we have caused these terrible vulnerabilities. And these migrating populations are not just vulnerable, but they're also full of knowledge, energy, resources, and they need to be taken into account. For example, in the city of Lima, we have a group of Shipios who are living close to the Rimac River under very vulnerable conditions, but they have made their life there, and we need to collaborate with them to improve their conditions, not just move them by force, but work with them, not from a top-down thing to looking at them as a vulnerable population, and that they have to do what we tell them from the outside as experts, but also always working in collaboration with them, taking into account their desires, their experiences. And with that, I close, and I'm very curious about what discussions we can have. Thank you so much to the organizers of this webinar and the presenters, and Baltica for moderating. Thank you. Thank you so much, Michael, for your presentation. And it's so nice how complementary the different presentations were. One about the children and adolescents and their experiences migrating in a region, and then another one encouraging us to act with what we already know. And now we have a Q&A about this. We have tried to record most of the questions from the chat. And so I'm going to ask some of them to our presenters. If you want to, Alejandra, Manuela, Miguel, turn on your cameras. We don't have a lot of time, so if the answers could be as brief as possible. So first for you, Mikhail, since you closed last, we have discussed mobility, the concept of migration and mobility for people who work, perhaps do not work specifically dealing with migrations. Well, it's a very complex issue, but we have populations that are mobile for many different reasons. Migration is when people move to live in a different place under different conditions for at least several months. There are different criteria, but the fact is that humans, since our early on in our history, we have had transborder, we have had mobility, but this is only seen as an issue or a problem, crossing borders and all of this more recently. And so migration has different phases and different kinds. And so we briefly can say that the more voluntary it is, the better, and the more forced it is, the worst. And so, for example, I want to highlight the situation of indigenous populations in Latin America. These populations are affected by climate change, and we are seeing internal migrations. But the context is a bit different because traditionally for them, mobility was a normal part of their economic and social life. And then the borders came and the property of land and companies, and all of this removed the possibility of having a mobile life, which was what they had to survive in their environment. So preventing the mobility for these indigenous populations is also a health issue. So we need to look specifically at what kind of population we're discussing. But sometimes migration is perceived as an issue. It's not an issue, it's a reality, but it needs to be handled politically, socially, and culturally so that it's not an issue for anyone. Thank you so much. It's a big question. There's a lot of literature with definitions about this that have also evolved with time. But thank you, yes, for reminding us that we have very diverse populations and experiences. And we see that all of these concepts evolve and are questioned over time. And so for Manuela, we were asked, how do historical factors such as discrimination and land property can affect the health of migrant children in the context of climate change? What do you think about this? Well, I think, could you please read the question back? Yeah, sure, no problem. It's how do historical factors such as discrimination and land ownership can affect the health of children in the context of climate change? Well, I would say these two factors that lead to migration will affect children. I'm trying to think of the last comment that Michael made, to think of not just vulnerabilities, because for children, of course, the effects of discrimination can be especially harmful depending on their emotional development stage, but the forced mobility due to the loss of land ownership also leads to migration towards urban areas, and this has also harmful events and effects on children. But we could also think that this also opens doors and opportunities for children. And if we think of climate factors, we also have the responsibility of thinking of the opportunities that these open for children. Perhaps children could be subjected to less discrimination than their parents because they're migrating at an age where they can get used to a different way of living. They're sometimes more resilient than older people. So I would like to keep thinking on this from different perspectives, with considering what Michael was saying, of thinking about it from that perspective. Yes, thank you so much. I think it's something that we should continue to reflect on. These are big questions, and they bring us to some specific angles, but always under the perspective of human rights. And we also have historical processes such as colonialism that create all of this between us. And Alejandra, the migration that is taking place due to climate change and political factors, it's of course due to the lack of adaptation issues for people in their place of origin. So what would be more appropriate, and how can we be sure that the place and destination will not vanish in the future? Well, thank you so much, Baltica, because your question is an invitation to think of this transnational dimension of climate justice or adaptation measures, or adaptation to climate change, depending on where we want to put the emphasis. And the regions where they come from, they can be affected by climate change, but also the places they arrive to are also affected, because we know climate change and migration are perhaps are phenomena today that show us the globalization and the dimension of how these are all universal experiences right now. And so both for migration and climate change, we need to consider the transnational dimension. So to prepare healthcare teams, our health systems, interventions in communities, dealing with regard to their own territories, we need to have these both at the place of origin to avoid migration and the dramatic consequences of climate change, but also to better face the risks and exposures to pollutants and other risks that can be suffered when they arrive at their destination. So this discussion around climate justice needs to be a commitment made from all sides of the continent, well beyond the definition of countries and whether they have the financial resources to lead with this, to deal with this. We need to have solidarity to deal with this from all territories. Thank you so much, Alejandra. These are the questions and reflections that everyone who is here with us is wondering about. Show us how this is a multi-factor issue and how important it is to continue researching, which is something many have mentioned. And Michael, I have another big question for you. So how much of migration is due to climate change? What do we know about that? Whatever you can say.
That question is impossible to answer because it's very difficult to really assess the effects of climate change on people's lives. Things are so different. It's not just the people that must migrate because of floods and stuff like that. Because some people have fled some climate change related issues, but many times there are droughts and all that, and then there are some companies that take the land, and what is the climate change there and what is extractivism is difficult to tell. Therefore, we need to consider that climate change is now making these reasons more serious. Now people have more reasons to leave their countries, but we cannot find a clear connection. This doesn't mean that we can say climate change effects cannot be detected. We know very well that climate change, together with biodiversity loss and extractivism and inequality, all of this is a complex situation. It is like some toxic combination. And we need to analyze all this in order to act and help people with their problems. They might be refugees or climate change displaced people, or they might be the victims of extractivism, but well, everything affects people. Thank you. Yes, people experience this at the same time, and this experience this in the flesh. And in this case, we're focusing on children and adolescents who are on the move. Thank you, Miguel. Alejandra, what do you think is the role of mass media when it comes to communicating these migrations? Have you noticed a change in the last few years on how people cover these news? Thank you so much. It's a great question because it's essential, absolutely fundamental. It's very important to see how we communicate all this. We always say that the media and words create our realities, and nowadays migration is communicated as a problem. However, thanks to, well, Miguel's definition, we know that migration is a historical um, element that allows communities and humankind to develop. As anthropologists, we know that humans need mobility to develop as a species. However, current mass media have a crucial role because they tend to communicate the negative side of migration, and they establish dangerous connections with crime networks, and they also exaggerate this spontaneous reaction because people tend to suspect from other people. They suspect from someone who behaves in a way in which I don't understand. It's very important to media outlets to actually be committed to non-racist communication so that we can promote a more complex knowledge culture on migration so that these aspects are actually highlighted, or how migration comes about, being able to understand why people migrate and how the situation they migrated from is also connected, it's also similar to situations we have in the destination country. For instance, in Chile, we've had a very serious wildfire season, and our nationals suffer from these fires. Our populations, our children, they are the victims of fires. And this, we empathize with these people, but it's very difficult to be compassionate or empathize with the suffering of other peoples that migrate. And this migration is narrated as dangerous by media outlets. Therefore, it's very important to have quality media outlets that are committed to this racism-free narrative that can actually face a challenge of this complex challenge of communicating all these associations which we detect as academicians between climate change, political responsibility, and social and political responsibilities. We need to take actions as communities, as individuals in our daily life, and also regarding our communities. They have an essential role for sure. And there's still a long way to go when it comes to being committed with between the academia, media outlets, and also from the natural sciences and health sciences areas. Thank you so much. One more question, dear Manuela. What you're saying is important. In Peru, we see that dengue is now affecting mainly children in some regions in the country. There are which other health hazards do our Latin American children face? Are there any data on this? Thank you. I think that we need to, are we talking about children in general in Latin America, or is it migrating children? Yes, it's migrating children. Okay. Um, I'm not sure we have data. I think that I would say that maybe my colleagues have more information about this or about data. I feel that we lack data, especially on irregular migrants, let's say, which is a high proportion of people. We need to assume then that they are more vulnerable. They are more vulnerable to diseases because they cannot fully protect themselves from these diseases. They have fewer rights to health in some countries. And that actually worsens their health issues. It's not just the health issues that people face in the destination countries. They are also vulnerable because they are invisible in many senses. So I don't want to speak more because we don't have much time, but it's not an easy question to answer. Thank you so much, Manuela. It is clear that the complexity between the country of origin, its demographic and epidemiological profile, and the transit, which is part of the migration process, and the destination country, all this entails different interconnections between different types of social, cultural, epidemiological profiles, etc. And this is also connected to the individual risks, including children, especially those children that are left behind because they don't know how to access the health system in the destination country. They might be afraid of being deported because of their irregular situation. Maybe they are alone. Thank you so much for your answer. Now, we would like to thank you in this remaining time. Thank you so much for being with us in this seminar. It's the first webinar of several seminars we will have every 2 months. The next seminar is on Tuesday, the 7th of May, at the same time, same channel, same registration process. We'll be talking about climate change and how it changes the health of women in Latin America and the Caribbean. Thank you so much for being here today. We'll meet again in 2 months' time. Thank you so much.